Hello guys, this is your host Sabir Hussain, a DVM final year student of UAS Lahore. Today I will be presenting a very rare and clinically important case titled Squamous cell carcinoma and papillomavirus infection in the prepuce of a boer bug. This case is particularly significant because it represents the first documented report of papillomavirus associated preputial squamous cell carcinoma in goats. Okay, let's move to the case. Let's talk about the signalment and chief complaints. The patient was a 4.5-year-old boer breeding buck weighing 86 kilograms. The main complaints include chronic preputial swelling, thick purulent discharge, and the inability to breed. The condition had been severe for the last 4 months, although the owner had first noticed mild swelling 9 months earlier. Now we will be talking about the detailed history. Okay, 9 months earlier, the bug developed mild swelling that responded temporarily to topical treatment at the farm. However, 4 months ago, the swelling and discharge returned and progressively worsened. 1 month before presentation, the bug had given ceftiofur, crystalline free acid, and oxytetracycline, though the dose was unknown and the prepuce was flushed daily with water. Despite these efforts, there was no long-term improvement, and that is why the animal was brought for clinical evaluation. Importantly, the buck urinated normally and maintained good appetite and normal defecation. Let's talk about the physical examination findings. On dermatologic examination, alopecia, thick crust, and pruritus were present on several body areas. Diagnostic tests confirmed chorioptic mange along with secondary bacterial and yeast infections. On preputial examination, the internal lamina was prolapsed, mildly swollen, and ulcerated. Reproductive examination revealed reduced scrotal circumference at 28.5 cm below the normal breeding range. Initial medical treatment. The first approach was to treat the mange and suspected posthitis, so the bug received ivermectin and was bathed with mild shampoo. He was given meloxicam and topical treatments were also applied, and the flushing of preputial cavity was also done. This treatment initially helped, but the condition relapsed quickly once therapy stopped. The relapsing of the condition made the veterinarians to think about the underlying cause. So they sedated the bug with ketamine, and a detailed examination was performed. The penis was difficult to exteriorize because of the pain and adhesions, and numerous raised round coalescing masses were present over the prepuce. Okay, biopsy samples and exudate were collected for culture and histopathology, and this was very important step for the final diagnosis. Now we will talk about the laboratory results and final diagnosis. Histopathology confirmed the squamous cell carcinoma, showing neoplastic squamous cell with pleomorphism, large abnormal nuclei, and high mitotic index. Immunohistochemistry revealed strong positivity for papillomavirus antigen, confirming viral involvement. And this was very important finding as it marks the first documented case of papillomavirus associated squamous cell carcinoma in goat prepuce. Then comes the treatment options and outcome. Treatment options included surgical removal, chemical methods or radiation, and chemotherapy. However, in food animals, these options are limited, expensive, and often not legally permitted. Most importantly, none of the available treatments could preserve the breeding capability. So, the cancer was aggressive and invasive, and the buck was unable to breed due to tumor and adhesions. Therefore, euthanasia was recommended. The owner chose to take the buck home, where he remained stable and gained weight but never regained breeding ability. He was eventually euthanized 5 months later. No necropsy was performed. It's time to talk about the key learning points. This case teaches us that the prepuce is an uncommon site for squamous cell carcinoma in goats, and this is the first report of papillomavirus positive squamous cell carcinoma in this location. It shows that papillomavirus may play a cancer-inducing role in goats, similar to horses and humans. And it also reinforces that when preputial inflammation does not respond to routine treatments, biopsy is essential to rule out neoplasia. Thank you for listening me and have a nice day. And if you have any question, you can ask in the comment section.